Hi, my name's Joseph Muchter. I'm a paediatric gastroenterology doctor in London. Welcome to the audiovisual presentation of our poster at ESPGHAN 2024 on the outcomes of diagnostic endoscopy in children with GI symptoms during and after the COVID-19 pandemic. So, this is our poster, which I'm sure you know because you clicked the QR code to get here, and thank you very much for coming. So why did we do this study and why is it important? Well, paediatric endoscopy is an important tool in diagnosing and ruling out GI pathology in children. However, we don't have much published data guiding selection of patients for endoscopy. And in the context of increasing prevalences of IBD and EOE, diseases that really need endoscopy, we need to make sure that we're refining our selection criteria to make sure that we are scoping the right children and our diagnostic yield is appropriate to balance benefits against risks. In addition to the risks inherent to procedures themselves, we have to take into account the environmental footprint of paediatric endoscopy, and green endoscopy is something that's been recently highlighted as an important factor to consider when choosing whether or not to scope. Now, our team had previously published data showing that the diagnostic yield of macroscopic and histological abnormalities in children undergoing first diagnostic endoscopy was around 49% for macroscopic abnormality and only 35% for histological abnormality. We wanted to see if that changed during the COVID-19 pandemic and whether, if it had changed, there was a sustained change in clinical practice thereafter. So there were two main aims of our study. One of them was to assess how the COVID-19 pandemic affected diagnostic yields in paediatric endoscopy, and the second was to try and outline the clinical and laboratory factors leading to diagnostic endoscopy and assess them or reassess them, comparing them with our previous study, for positive and negative predictive value for histological abnormality. This would help add to the reference data generated in our previous study, as well as to help guide clinicians in selecting patients with diagnostic endoscopy in order to maximize diagnostic yield. And we hypothesized that the proportion of abnormal endoscopies would increase during the COVID-19 pandemic restrictions, but would then reduce again to pre-pandemic levels once restrictions were lifted. And how did we do this? We analysed all first diagnostic endoscopies performed over two 6-month periods, one during the peak of the COVID-19 pandemic during lockdowns, and the second 2 years later once restrictions were fully lifted. We looked into clinical factors, endoscopic factors, histological findings, and documented them all. Biopsies were always reviewed in a weekly histopathology multidisciplinary team meeting with final agreed outcomes. And a key difference to our study to a number of other studies is that our criterion standard for abnormality was histology, not just macroscopic findings. So, what did we find? Well, it may come as no surprise that during the pandemic we performed far fewer first diagnostic endoscopies in children, only 69 procedures in 37 children. A slight majority of these were male with a mean age of just under 11 years old, and the majority of children underwent both OGD and colonoscopy at the same time. But what was striking was that there was a significant proportion of patients who had both macroscopically and histologically abnormal endoscopies during this time. Post-pandemic, the demographics had not changed very much, although we did perform more first diagnostic OGD-only procedures on children and a smaller proportion of OGD and colonoscopy procedures on children. The rates of macroscopic and histological abnormalities did decrease from the pandemic levels. However, when comparing these to the pre-pandemic levels we had identified in our 2014 study, they were still significantly higher. And here's that demonstrated. Comparing the 2014 data to our post-pandemic data, we found that the macroscopic abnormality rate significantly increased in our latest set of data versus 2014 for all procedures, with statistical significance in all procedures and in OGD and colonoscopy procedures. We also found that histological abnormality, our criterion standard for an abnormal endoscopy, also significantly increased for all procedures, for all OGD-only procedures, for all OGD and colonoscopy procedures, and for all OGDs excluding those being screened for celiac disease. The grayscale pie chart represents the 2014 study, and the coloured pie chart represents the 2022 study that we have just done. As you can see, we have a normality rate of 33% histologically, And other main diagnoses were celiac disease, Crohn's disease, gastritis, and ulcerative colitis. As expected, the number of first diagnostic endoscopies reduced greatly during the COVID-19 pandemic, but post-pandemic returned to similar numbers to the previous study. That comes as no surprise, as during COVID and restriction times, we were not scoping as many patients. However, there was a striking increase in the percentage of patients found to have histological abnormalities identified during the pandemic, from 35% of patients in 2014 in the original study to 84%, suggesting that we were much more selective in the patients we were selecting for endoscopy during the pandemic. Interestingly, in the period after pandemic restrictions had been lifted, this still remained higher than the 2014 level, suggesting that there was a lasting change in practice in refining who we select for endoscopy since the original study. There were no delayed diagnoses or patient complaints since that change was made. Why this is, we're not entirely sure, but further work will be done to examine the reasons for this. So thank you very much for listening this far. We really hope you've enjoyed our poster and our work. And come and say hi if we see each other at ESPGHAN 2024. Bye.